welcome to the studio now Dr. Briana Cain. Thank you so much for being here, a naturopath here in the Valley, and you have a booming practice, and we're excited to talk to you about the wellness journey.
Yeah, thank you again for being here, and I'm a huge fan of naturopathic medicine. So before we get into some of this, I just want to define exactly, because you're going to be talking about biochemical factors and how they can influence mental health decline. So first off, just kind of describe to me first what a biochemical factor is.
Absolutely. So when we're talking about the central nervous system, the brain, and your peripheral nerves, a biochemical factor is a signal. It's a neurotransmitter. It's a chemical that gives signals to your brain to tell it how to behave.
Right. What I was talking to the doctor about, before we went on the show to tape today, and I said, okay, that makes sense to me.
So in talking about that, how do you train your brain a bit to get into a better state of mental health?
Well, there's a lot of different things that can influence that, right? Everything from lifestyle factors to diet to genetics, chemical exposure. There's a lot of different things that influence those types of things and your neurotransmitters. So we need a balance between neurotransmitters. There's about 30 different neurotransmitters. They do different things. Some of them are excitatory and some of them are inhibitory. So we want a balance between those. And there's a lot of different, like I said, lifestyle things, diet things that you can do to maintain that balance and to prevent mental health decline.
So when we're talking about supporting our overall wellness journey, but in particular to the conversation we're having today that supports our mental health, what supplements can we look at? I mean, how can we really, if I'm watching this or listening to this, where do I start?
Yeah. Right. So there are a lot of different vitamins and cofactors that your brain uses not only to generate those neurotransmitters, but also to break them down. So we want to make sure that we're producing them effectively, but also that we're eliminating them when we're done with them. So those nutrients are things like magnesium, B6, and CoQ10. Those seem to be the top three that people are deficient in when they struggle with mental illness or decline. And then making sure that you get enough antioxidants. So things like vitamin C, and again, going back to diet, making sure you have lots of different variety in your diet, lots of different colors of fruits and vegetables. Anything that's very colored, like green and leafy or bright orange or red, those are full of antioxidants. That's really good for your brain.
Is there something that we can do, because everybody's different, we all react to different foods differently, right? Is there a way that do we do a simple blood test? Is it like, do we just do a little prick blood test, in order to understand our body composition? Because I'm assuming, right, what may be right for Carey and helping her may not be the right plan for me.
Absolutely. So there are ways to test food intolerances, primarily through blood. That's a blood draw, and we can test different types of food sensitivities. But also when it comes to your neurotransmitters, there's an excellent urine test that can tell you if you have imbalances in any of those variety of chemicals that are active in your nervous system.
It's the first time I've ever heard of that. Do you do that at your office?
We do.
You do?
What do you
I'm
ask
make an
for
appointment.
people who are not here in the Valley? I mean, for folks who want to come see you, that's great. But if they're elsewhere, what do you ask for?
Yep, it's a neurotransmitter test, and you do it at home. It's just a little kit that you do at home, and then you send it in, mail it in to the lab, and then they send me the results.
And then what does it tell you specifically?
It will tell us exactly whether or not you have any deficiencies or excesses, and any of those. I think there's about 30 different neurotransmitters that they test for. And they also take into account if you're taking any medications, how that might impact your result. Medical director of that lab goes through every test and makes recommendations based on, what your imbalances are. And then when I look at the test results, I can interpret them and then help the patient to learn what kinds of foods they should be eating or what supplements they should be taking.
Dr. Cain, before we wrap the segment, I'd love to have you just speak on the fact of just what do you think, the significance if we really try to dig a little deeper and understand our own body composition and how that relates to our mind? Brandon was talking about my horrible lack of water intake, but really kind of getting real with ourselves but understanding what are we deficient in, what can help us so we can truly thrive.
Well, your body's really amazing, right? Given the right environment, it will heal itself. So we have to facilitate that by making sure we get enough sleep. 6 to 8 hours is super important, and a lot of people just don't get enough sleep. Making sure that we manage stress, we talked about that cortisol piece. Not only is it eating poorly and causing inflammation in the gut, but that constant go, go, go is really hard on our adrenals and our nervous system. So making sure you manage stress appropriately, that you're getting exercise, because we want to improve blood flow. We want to make sure that our elimination pathways are open, so drinking enough water. So really the basics, just being conscientious of living a healthy lifestyle. I think most people are aware that, eating fast food and a lot of sugar and not exercising are not good for you, but it's not that they're just not good for you. They really do have a strong impact on your overall health and well-being.
Yeah.
Wow, that's fascinating stuff. Thank you for a lot of that insight. I'm so curious about doing that like urine test to figure out what your body is so deficient in.
Absolutely, it's fascinating, and for every person it's different.
And how long, just lastly here, how long does it take once we do that test and we begin taking these supplements and we change our dietary components, how long does it take for our bodies to respond to that, to see a difference in our mental health?
Honestly, because we're doing it naturally and not so superficially and synthetic like you would with pharmaceutical, 3 to 6 months on average.
Okay.
Yeah.
Yeah.
I like it because you keep it real. You don't try to say like, okay, within 15 days we're gonna.
But it's just like when you're changing your lifestyle, and you're trying to lose weight. It's like the quick fixes never fix anything, right? You may look good for a couple weeks, and then a couple weeks later it's coming right back. I think that 3 to 6 month mark is a really good thing with anything to form a new routine and a lifestyle, and that's when you begin to see those impacts.
Absolutely.
Doctor, thank you so much.
Thank you, Dr.
Thank you.
Cain. Thank you so much.
And don't